Great.
Yeah.
Well, we'll get right into it because Santi only has a half hour, so we'll get started. Welcome, everybody. Thank you very much for being here. And Santi, I am recording the meeting. Is that okay with you? Okay. And then I'll just ask everyone who's not talking to keep their mic muted. We'll rotate through some questions, but I just wanted to give a brief introduction of who we are, and then Santi, maybe you could give a brief introduction for yourself, and then we'll get into the questions. So we're a group of Colorado citizens who are concerned about the state of healthcare in the United States. We specifically support the Medicare for All bill, as introduced by Pramila Jayapal and Bernie Sanders as the solution to comprehensive healthcare coverage for our society. We've been working with National Nurses United through their congressional district strategy to talk to and push lawmakers to support Medicare for All. This started as a Colorado District 3 group, but as we were reaching out, we realized that people from all over the state wanted to be involved, so we opened up the meeting to all of Colorado. We want to use this meeting to get to know you, Santi, and get an idea of where Senator Bennet's office stands on Medicare for All. We are hoping to have ongoing meetings with your office and are really hoping that we can eventually meet with Bennet himself for a chance to talk about our personal healthcare woes and how Medicare for All would significantly change our lives. But at this meeting, we want to listen to you. So we have a series of questions that a few of us will take turns asking that will help us better understand Bennet's stance on different healthcare issues. And then if you just want to give us a quick intro, if you have anything to share about like why healthcare policy is important to you, you're also welcome to share your personal thoughts on Medicare for All, but no need if you don't want to. So go ahead and give us a little introduction.
Yeah, I mean, it'd be helpful actually if folks, so that we don't have to go around the room, but if they want to just put in the chat where they're from, just so I get a sense of where folks are coming from. My apologies, I guess, if you're from, I guess the third is struggling right now. But anyways, so, but yeah, please do. It'd be helpful to hear where folks are from, and I'll put my email in when people are done, so that folks know how to get a hold of me. So yeah, my name is Santiago Gonzalez, or Santi, as you can call me, and I am currently Senator Bennett's senior policy advisor in his office. My focus is healthcare, but I do a number of other things like some family issues like foster care and youth, and some workers' rights work, and also work on some immigration stuff as well. So wide range of things, but that's sort of currently what I do. I try to play a role in ensuring that there's sort of equity in our process, throughout our process of writing bills and legislation, to make sure that there are those perspectives, not just reached out to at the end, but incorporated throughout our processes. So that's my background on my job. I was born and raised in Colorado, at Westminster, which is where I currently still am, and moved to DC almost 6 years ago. Started working for Senator Bennet about 4 years ago, left and worked for a number of other people, and then came back early 2020 and have been in the position since. So yeah, I have my master's of public health, which is why I moved to DC originally, and focused on health policy. I've done stints in research. I worked for an investment bank for a while, where I got to really learn the ins and outs of the healthcare industry and their business models, so that they can't bamboozle me when they say certain things, which is really helpful. And then, yeah, for the past 4 years-ish, have been working both in the Senate and the House, mostly for Colorado members. So I worked for Jason Crow for a while, and then yeah, came back. So that's a bit about me. Yeah, I'm happy to. I mean, I'd be happy to take questions on things. I mean, I'd be interested to sort of hear as well, just because we haven't heard, but whoever's asking a question, just sort of give background about themselves and why they care about this. I mean, I think healthcare is probably the most consequential thing outside of sort of climate change, probably, that we should be working on. And so I'm absolutely just would love to hear folks' stories as well, as they ask questions.
Okay. Yeah, that's great. We were gonna have people introduce themselves a little as they're asking. So Gwyn will ask the first question, and then Lauri, and then Sally. I'm not sure how many of these we'll get through. We do have the last question on the list we do want to get to, so I will try to stop the conversation in the last 3 to 4 minutes so we can ask that question. So Gwyn, if you want to go ahead.
Hi, I'm Gwen Unger. I live in Forest Lakes, which is between Bayfield and Vallecito, near Durango. I really started getting involved with healthcare and health insurance and how you pay for it when I had my own business back in the early 2000s. And it was a problem even back then, trying to have a policy for our employees. So the question I wanted to ask you was, since we know that the United States spends about twice as much per person on healthcare as other developed countries, that means that businesses in other developed countries who have universal healthcare don't have to pay for health insurance for their employees. And it would seem like that would put our companies at a big economic disadvantage. So my question is, what would the senator propose to do about this?
Yeah, no, that's absolutely right. I think that that's an important distinction, and something that my dad, for example, is a small business owner, so totally understand what it is like not being able to, or when wanting to pay for healthcare. I think I think, and genuinely, there are people who have businesses that want to be able to do this because they feel like they're able to provide better care in some circumstances. I'm going to never say all circumstances because that is absolutely not true. But there are some folks who sort of say, we want to be able to be competitive. We want to be able to offer these types of services, which something like, just throw out there, like direct primary care, so that people can go and see their primary care doctor right away. And that's something that, if we don't cover that under Medicare, and we don't do that in that way. So there are types of things like that I think folks in the business community have said they want to provide. But I think on the other side, it's because we have this culture of that is sort of part of the benefits package, right? That is part of what has always been the case. And I think there needs to be, and there is a cultural shift moving. I think especially right now in light of COVID, where you had a lot of people who lost their jobs, lost their healthcare in the middle of a pandemic, that absolutely should not be the case. I think that there's a number of folks. Sorry. Okay, sorry about that. I think there's a number of folks who say like things like COBRA are the answer. I would argue that that's not necessarily the answer, because it just continues to give money back to the insurance companies. There are people that say that, better. I think that there are people that say that better tax credits for this care is going to be helpful. Again, that money eventually just goes to insurance companies and back into sort of the cycle, which is why I think in his position, there's a few different things that I think are important. One is we need to encourage and make sure that the safety net exists, so that if people are in a position where they lose their healthcare, which honestly, 4 years ago, before I started working on the Hill and in this job, I went through a 6-month period where I didn't have health insurance, and it was very stressful. But there was a safety net where I lived, in which I was able to go get care when I needed it. And so that would include supporting community health centers. I think that includes making sure that that folks are required to care for uninsured people, regardless of, I think, an important piece of this, immigration status. Sorry, I'm realizing I have the floor of the Senate on in the background, and that's the noise. So I'm taking it away, sorry. And then I think his perspective, which I think is what we're getting down to, is, we want to be able to provide a plan that is sort of uses the Medicare system, it's what works, but actually provides the type of things that people who, if you are a 30-year-old pregnant individual, you're going to need different type of care at that age than you will if you're 70 years old. And so, the way that Medicare is currently structured is it doesn't provide that care for that younger person. So how can we utilize what's working administratively, and provide an option so that in the case that you are, either laid off, or if your employer, I know in Colorado, there's an effort of employers actually just paying the premiums on the individual market. And there's a number of folks trying to do that, that would be less disruptive if you were to lose your job, because you're still, just going to get coverage through that. So I think all of it sort of stems together in that there's this culture piece, there's the system piece, that the way that I think things are structured right now aren't working. And I think that's why it's important we have these conversations, because we need to make it clear to legislators and to the White House that things are currently not working. They didn't work the past year. We need to make sure that we're doing things that shake up the system in the right way.
Thank you. We're just going to move through the questions. We were going to maybe do some follow-up if we had more time, but
yeah, no worries.
We'll move on to Lauri.
Hi, Santi. I'm Lauri Costello. I'm a family doc. I practiced in Washington State for 25 years and am retired in Durango, and consistently concerned about so many inequities in our system. Really happy to hear you say that equity is of paramount importance for the senator. So we spend twice as much, at least, per person as other developed countries, and out of 11 developed countries, we rank last in quality for our healthcare. So we spend more and get worse outcomes, and significantly worse outcomes during the pandemic. So my question is, what does the senator propose to do about this?
Yeah, and it's interesting because I think people, I'm sure you heard talk about this K-shaped recovery for economics, but I actually would argue that that's also was amplified in our healthcare, because I think that there is a larger number of folks who are actually getting better care than they might in those other countries, but because there's such disparities, we have so many individuals now who are in a position where they are getting such far worse care that it actually brings down our quality ratings in many ways. There's a few things that I think are important that other countries do a lot better than we do, and I think the main one that I would say we're trying to focus on is access to primary care, and making sure that people have a provider, I guess what we call a health home, I guess, in that this is a provider that knows them, ideally is from their community, ideally has this cultural competence that they feel comfortable going to that person for whatever that is. And it might not just be related to their healthcare, right? Like it might be related to transportation, might be related to, name the thing, nutrition, all these things. So one of the things that we're trying to do is making sure that people can get primary care at no cost to them. So they would have, as many of you know, when you go to get your yearly checkup, you might have to spend $20 or $30 as a copay. What we're finding is that in itself prevents people from going, particularly, I would say, men of color, particularly have really bad outcomes, and women of color, but I think they're more likely to want to take care of themselves, to be honest. And it's mostly for them the timing that they don't have. So I think one of the main things we're trying to do when we're thinking about structuring this is making sure that their reimbursement levels are at the right place, and that the cost for primary care physicians, so that them compared to specialists who may spend a lot of money or get reimbursed a lot, even though they're just looking at one aspect, they're not looking at people holistically like primary care providers are. I think those incentives are all wrong right now. And so what we've been trying to do is say, and in Senator Bennett's proposal, he wants to make sure that primary care is at no cost to the patient. So I think that's the biggest thing. I think, though, there's a lot of other things related to equity and quality. And ultimately, I think it's because we just have not empowered the patients in many ways to be able to advocate for themselves, whether because of cultural competence or because of these things. And so I think what we're trying to do is make sure that there's a lot, I think, more training that needs to go into making sure that every provider is sort of ready to care for folks. And then I will just say, I think one of the things we're thinking about a lot is the disparities on prescription drug pricing. We obviously pay way more money, and the argument is always, well, we're the ones who develop it, we're the ones who create jobs, and so we should. I think we want to be able to negotiate for drug prices and have a cap on how much we're paying for these drugs, which doesn't exist right now. And two, I think it is actually unfair that sort of these companies can rely on United States paying so much, and sort of I'm not one to be contrarian to making sure that we're taking care of our global health partners, because I think that that's important. I think we're seeing that with COVID, but I also think that there is a level of unfairness there, that some countries get to pay so little for the drugs that we have to sort of subsidize. So I think that's something that we're also looking into. And ideally capping how much those revenue they get from revenues, because they get a lot of revenues and profits that don't go back to things they say it goes back to. So
Thank you.
Okay, so next we have Sally to ask question number 3.
My name is Sally Sharp, and I live here in Durango. I work for a nonprofit, and I had worked for LA Unified School District for 20 years and had amazing health insurance, my entire family and me, and it was fantastic. A lot of union work went to that. But I'm here because my husband couldn't afford health insurance for the first 6 months of this year. And he's an adjunct professor at CSUP, and it's ridiculous. We just couldn't afford it. It was twice as expensive here as it was in Pueblo. And it's ridiculous. So that's why I'm advocating for it. So my question is, the United States is the richest country in the world, but millions of Americans can't afford healthcare. Roughly 30 million Americans still don't have health insurance. 59% are of people of color, and tens of millions more are underinsured, meaning they cannot afford to pay their deductible. What does the senator propose to do about this?
yeah, I think they're not affordable plans right now, right? Like, I think it's very, very clear. I think one of the things that we did actually, and it's in Senator Bennett's bill to make permanent, but we passed this for 2 years, was improving the tax credits for these plans, so that when it's, for people earning below 150% or of the federal poverty level, they actually can get plans and not pay anything, no matter where you are. For people, and then there's sort of a stepwise process where if you earn above 400% of the federal poverty level, which honestly is not that much money. It's for a single person, it's like 12,000 times 4. So that's, let's say, above $50,000 a year, you're not going to be paying more than 8.5% of your health insurance on a plan. So that covers the premium part of thing, but that's the single part. That's only a single part. Well, we have concerns with the deductibles, which is a huge concern. that is something that we've been really trying to think about how to restructure, because there's no requirements on what deductibles should be right now. And I actually, it's something that there's ongoing conversations that we're having on what legislative, if we need to make a legislative fix on that. I think one of the things, Sally, which is what I raised earlier, was the primary care piece and making that without a deductible. So by making that without cost sharing, that would mean that there would be no you'd have to pay copay or deductible for that. And so that's one way of going out about it. But that doesn't fix the problem of you're out there skateboarding and you break your wrist, you have a $2,000 deductible. That doesn't fix it.
Exactly.
Right.
Exactly.
So,
yeah.
Even though this person probably has health insurance. So I think there's a huge problem there on that. And I am welcome to take suggestions on sort of how we go about that. But I would say, I mean, I think there still are patients right now under Medicare who still have to pay out of pocket for certain things. And that's problematic too. So I think we need to make sure that we're trying to fix the prescription drug issues under Medicare, because there literally are unlimited costs to the patient after you pass a certain level under Medicare. So I think there's a number of restructuring things we're trying to do when it comes to that. And then I think one of the things that we were able to do, which is important, and Senator Bennet worked really hard on, was surprise billing issue, which is going to go into effect in 2022, which allowed a lot of physicians to provide services that weren't covered and not have to tell their patients until they gave them a bill. And that's prohibited, and that will not be allowed anymore federally. We did that in Colorado at a local level, but there will be a federal thing. And I think that's going to really help, get transparency into, like what I said before, business models, which Senator Bennet would say, healthcare is the only business where the business model relies on, he says healthcare and tech, but they're the only industries where the business models rely on opacity, and that's incredibly problematic, and something that, if we allegedly live in a free market capitalistic world, there should be freedom of that information, that we don't have that right now. So we need to get that information. So those are things, I think, a few things he's done and things we're looking at, but happy to absolutely take suggestions or consider it any option to sort of reduce that out-of-pocket cost.
Thank you. Is going to ask question number 4. Thank you, Santi.
And I just so you know, I have about 5 to 10 minutes actually after I realize that I only have something at 12:40. So if we need to stay a bit longer, we can.
Right. My question is easy. It's a yes or no question. My background is that I first visited Europe in the early 80s. And so for almost 40 years, I have been passionate about universal health care and realize the issues we have in America. So I want to know, yes or no, does the senator believe that everyone in the United States should be able to get the health care they need, regardless of who they are or how much money they have?
Yes, and I think to highlight the point that it needs to be affordable and high quality. Absolutely.
At 5.
That was it.
Thank you, Karen.
I don't think we heard you, Leah.
Oh, sorry. Jan's going to ask question 5.
Okay.
Hi, Santi. My name is Jan Phillips, and my husband and I own a small business in Durango. And a few years ago, my husband and I were paying $24,000 a year just for our premiums. We had a combined deductible of $13,000 a year, or $37,000, all before insurance even kicked in. And we weren't alone. That's when I decided to start researching the healthcare industry and learned of the profit-driven underbelly and became an activist for healthcare reform. and that health insurance costs have only worsened. So my question for the senator is, within the ACA, healthcare is considered a commodity, a product to be bought and sold. On the other hand, a public good is regarded as a service that's provided without profit so all can benefit, like public education. The American public education system has been the foundation of the world's most prosperous country. The healthcare industry has not controlled runaway healthcare costs for over 2 decades. They utilize denial of care as their business model. They depend on denials to keep their businesses profitable. Instead of taking accountability to lower costs and maintain adequate coverage, they spend millions of dollars to keep healthcare unaffordable with ever-narrowing provider networks. So my question is, what concerns or objections does the senator have about health insurance to be a public option, covering every citizen with more comprehensive coverage at a lower cost, similar to public schools?
Yeah, no, I think that's a great option, and I think that's the goal of what we're actually trying to accomplish through Senator Bennett's public option bill, is that the way that it's structured is that it would utilize the Medicare system, but utilize the rules and sort of the requirements, and actually elevate the requirements that are under the qualified health plans under the Affordable Care Act. And the way that we structure the bill and have written it after, I think this iteration is the 3rd iteration that we've released, is there would be at least 2 options in every rating area in the country. A silver level and a gold level plan, so that it aligns and is less confusing for the consumer as they're getting it. And then that person would be able to get this option using the tax credits that they get that we talked about earlier. Or if the insurance industry wants to compete and actually provide good care with better networks, then that individual can go and get that plan, right? But I don't think I think we need to make sure that we're enforcing the standards of the plans that exist now. But I'm just going to be honest, Jen, I don't think that covers the issue of the deductible and the cost. Like, it really doesn't. And so one of the other things that we are considering and are advocating for is putting a lot more money into antitrust enforcement, because and sort of other types of enforcement for bad practices, because what they're doing, and as many of you know, is there's a lot of these we just call large hospital corporations that are eating up all the small guys, and they're saying it's for integration, we're going to save money, we're going to do all this stuff. Their prices only increase. And so if you're going to eat up one of our hospitals in Durango or somewhere, that they've been operating independently, but they don't have the resources they need to remain on their own, they shouldn't be allowed to do that unless, that doesn't actually lower prices, and it doesn't do all those things that we need to do to actually control the true cost. So I think there's a lot of work that needs to be done on the enforcement side of things to make sure that that companies aren't merging, that all these industries aren't coming together and taking advantage of patients, which is what's been happening for honestly the past 20 years in our healthcare industry as things have changed. So I will say that those are a few of the things that we're attempting to do. And I'll just plug this, but we feel as though the administration isn't being strong enough on wanting to address these issues. And usually when I go to advocates and talk to them about this, they say, well, we need to get a little bit more information from the White House or from the administration to decide how we're going to push our message. And it's become a little bit of a chicken and an egg situation. And so what I've been trying to tell the advocates is, no, we can't wait for them to come out with some plan, because it's not going to be what we want it to be. We need to start now advocating, which is why I think these conversations are important. And but I will just say that from my perspective, it would be we need advocates and we need people's networks to really be pushing the administration to say, you ran on this, we're going to take you seriously and we want you to do this. And I think that will be helpful as we can advocate and be your voice when we're in Congress.
So maybe we have time for one more question and then our final question. I think we can get that in. And Gwen will ask both of those. So I'll let you take it away, Gwen. You're muted, Gwen.
I should know better. Santi, there's about 700,000 medical care related bankruptcies every year in the US where a person or family loses everything they have due to illness or injury. In 2019, a third of the applicants on GoFundMe pages are for medical bills. More than 8 million Americans have started a crowdfunding campaign to pay for medical care. And of course, 90% of those campaigns will not raise the necessary funds. And 2 years after a cancer diagnosis, 42% of patients depleted their entire life savings, according to a study published in the American Journal of Medicine. What can the senator do about this? This is a huge, huge problem.
Yeah, I'll say I will be happy to, I think, take suggestions on what some of this looks like, because I think it, the easy answer is to say cover people, make sure people have health insurance. But I think to someone's point in the chat, there are doctors who don't accept health insurance, right? Like that's problematic, and that is not going to remove the issue of someone who is going to a specialist or someone's going to a doctor who's still going to charge them even though they have insurance. So I think, I think there's a few sort of things that we need to be doing. One is at the baseline, make sure people are covered. Two, I think we need to be understanding the true costs of these services and these products, and make sure that they're not being inflated and sort of charging over what they should be. And again, that goes back to the point of transparency and not understanding what these people are charging or why they're charging it. And so I think that's an issue. I do think we need to be able to understand the reason why someone might have to file for bankruptcy. I don't think that people sort of economically should be, there should be opportunities for them for, in a situation like when you get sick where you don't have any control over this, that shouldn't sort of mean you have to sell everything you have just to pay for that. So I think that that's a really difficult question to answer, and there's some steps we can move towards doing that. But I don't think there's an easy answer there. So I'm sorry that that's not the best answer maybe, but yeah.
Okay, so that's fine. And the last question that we came up with, Bernie Sanders has introduced his Medicare for All bill in the Senate for a number of sessions in a row. And we need to understand that this doesn't just mean we take the current Medicare and have everybody covered. Both the Sanders bill and the Jayapal bill in the House extend the things that are covered, so that most of what we've talked about today goes away. We don't have any more bankruptcies. We don't have people who can't go to the doctor because they can't afford it. So I think that I can speak for a lot of the people on this call that we would really like Senator Bennet to co-sponsor this bill, even if he feels it can't pass at the current time. So the question is, what would it take for Senator Bennet to move to that position?
Yeah, that's a great question. I think we've always been in a position where we talk to Senator Sanders and his staff all the time, and we always have the same goal here, which is ensuring that that everybody's covered and that the services are high quality and low cost, right? Like that is the goal. And I think him and Senator Sanders have had disagreements even on the presidential stage, right? Like that's I think it's pretty clear that their positions are different. in this. And I think the main thing is, I have not seen the most recent bill, though I'll be honest, I do talk to Senator Sanders' staff pretty regularly. Some people don't think that happens often, but it's true. We do talk a lot. We text each other on many different things a lot. And I would just say that, I think we are in agreement that it needs to take the whole entire sort of caucus to move forward, to take the steps forward we need to. But I'll just be honest, like, Senator Bennet does not think that there should be a singular sort of plan and only one thing that is available to everybody. I think he's in a position where he wants to make sure that there are at least options for folks. And I think he's always had that position. And so I guess the question is there a way to do this in a way that, encourages innovation and value-based payments? We're not paying for things at a fee-for-service level anymore, but we're paying based on outcomes, based off of if their products, if their services actually are doing things to make sure that people are staying healthy. But I'll just be frank and say, like, we continue to have conversations with them, and will continue to have conversations with them, and make sure that we are locked in arms to make sure that we're expanding healthcare and improving healthcare for everybody. And that's something that he's dedicated to. And there's different ways to go about it, different tools we can use. I think those are the disagreements, but I think we ultimately agree on more than we disagree on. So.
Thank you very much for meeting with us. I think, it's probably about time for you to take off. So we are hoping we can continue these meetings. So I'll reach out to you about future meetings to kind of get more into healthcare stories and, really more why we support Medicare for All. And we want to talk more about that in particular. And we do, I'll mention again, really want to meet with Senator Bennet at some time eventually. So if you could put in a word in with him for us, that'd be awesome.